Hi and hello everyone, welcome to the Nursing Virus YouTube channel. This is me Loganathan. Nowadays, in most of the government exam for the nursing officer or staff nurse grade exams, apart from the direct MCQ, they are focusing on the medical related scenario based or the instruments image based or even that many of the devices, medical devices they were focusing. And even they are giving much attention for the clinical based knowledge. So be prepared and get familiarized with those areas. So on the today video, I am going to discuss the complete image based MCQs for the upcoming competitive examinations.
Do subscribe on Nursing Virus channel if you not yet done. And don't forget to click the bell icon and like button so you don't miss any videos.
We'll go with the today discussion. Image 1. Identify this item shown in the below picture. Options are cardiac shunt, coronary stent, cardiac pacemaker, and vascular ring connector. The correct option is coronary stent. Here the rationale for the coronary stent is a tube-shaped device. So on the image you can see it is a completely up to this only. So it is a kind of an tube-like structure placed in the coronary arteries that supply blood to the heart to keep the arteries open in the treatment for the coronary heart disease. So this kind of procedure, when you are placing that this tube-like device on the coronary arteries, the name of the procedure is called as percutaneous coronary intervention. Second image, diagnose the underlying disorder shown in the photograph. Options are adherent placenta, retained placenta, placenta previa, abruptia placenta. So here the correct option is placenta previa. So here we'll see the normal placenta and correct position of the placenta will look out in the image 1. So here you can see this is the placenta which is normally attached inside the uterus area, either in the top or in the side or in the front or even in the back side area. It should not lie at the lower top. For example, on the given image, this one is the given image. On the given image, you can see the placenta were attached in the lower part of the uterus. If it is attached in the lower part, that is called as placenta previa or lower lying placenta. This is completely an abnormal condition. Image 3. Identify this instrument shown in the picture. Options are proctoscope, Doyen's retractor, Davier's retractor, and Cusco's speculum. The correct option is Cusco's speculum. So here the rationale. So the Cusco's speculum, or it's otherwise known as duck's speculum. Why mean? The instrument will look like the duck mouth. So this area will look like a duck mouth. So it is otherwise called as duck's speculum. Here the uses of this speculum is to retract the anterior and posterior wall of the cervix, and second one, examination of the vagina and cervix, third one, to take the cervical smear, and fourth one, to insert or remove the IUCD, and fifth one, to take vaginal and cervical swab. So this instrument completely utilized in case of females for examining the vagina and as well the cervix area. And fourth image, identify the size of the cannula in the given image. 14th gauge and 16th gauge and 18th gauge and 20th gauge. Here the correct option is 14th gauge. Here we'll see the rationale. So here the different size of the venflons or the IV cannulas are given. So here on that scenario, based on that image which is given on that question, that is the orange color, 14 size, that is the maximum flow rate is 270 ml per minute. So this one and the grey color, that is a 16 gauge venflon, commonly used in the time of trauma and surgical procedure. And for the green one, 18 gauge, that is that 103 maximum flow rate per ml per minute. So this also will be used for the trauma and quick blood transfusion. And for the pink color, that is the 20th gauge size, that is a normal IV cannula, commonly will used for most of the adult patient, and this also will be used for the blood transfusion. The maximum flow rate is 67 ml per minute. And for that blue one, that is a 22 gauge size, that is around 31 ml per minute, the maximum flow rate we can give. So this is also commonly used for the children and older adult, where we cannot able to find the veins easily. This venflon can be much helpful. And 24th gauge, that is a yellow color, commonly used for the neonates, that means the newborns, and the children's and elderly people. The flow rate is 30 ml per minute. So out of this all venflon, anything can be asked. So don't forget the gauge size and the flow rate, and as well the purpose of the each venflon. Sometimes they may used to give only that color of the venflon, and they may ask the purpose of using the particular venflon. And fifth one, identify the instrument shown in the below picture. Options are urethral sound, bladder sound, uterine sound, and uterine cavity. The correct option is uterine sound. Here, the identification of this instrument, on that long straight blade you can see. On this straight blade you can see the measurement on or over the instrument, and as well the end tip you can see, that is around 30-degree angle it will use to get bent. And here in that over the top area, around 5 centimeter length tip you can see. So this is the major difference between uterine sound and bladder sound. So the use of this instrument is to know the position and the direction of the uterus in case of retroversion, and measure the length of the uterine cavity and cervical canal. So don't make confusion between bladder sound and uterine sound. Sixth image, what does the following ECG indicate? Options are atrial flutter, atrial tachycardia, and functional tachycardia, ventricular tachycardia. The correct option is atrial flutter. So the rationale is, on the image, that is a rapid, identical, undulating waves you can see. So here the rapid and undulating waves you can see, that is called as F or flutter waves. This kind of waves as a kind of an short tooth or undulating appearance you can see. Yes, similar to the sharp blade you can see the ECG waves, and report F waves to QRS ratio. Between that QRS ratio, the complete F waves only you can see. The complete baseline will be absent and cannot measure the PRI and QRS waves, and the rhythm of the ECG or the heartbeat may be regular or irregular. The counting of heartbeats may be around 250 to 300 beats per minute you can see. Seventh image, the given instrument is used for providing exposure for visualization of dash. The options are uterus, vagina, rectum, and nose. So here the correct option is rectum. So on the given instrument is named as proctoscope. So this instrument will be used for the proctoscopy, is the common medical procedure in which an instrument called proctoscope. This instrument also known as rectoscope It is used to examine the anal cavity, rectum or sigmoid colon. Eighth image. Name of the maneuver shown in the picture. The options are choke maneuver, Epley maneuver and Simont maneuver and Hemlich maneuver. The correct option is Hemlich maneuver. So this kind of maneuver can be performed when that windpipe is getting blocked. They'll use to perform the Hemlich maneuver. We'll see how they are performing the Hemlich maneuver mean. The person will be performed 4 steps. The first one, lean the person forward slightly and stand behind the person. So this is the affected person. And second step, make the fist with the one hand. And third step, put your another arm around the person and grasp your fist with your hand and near the top of the stomach, just below the center of the rib cage. So here the fist arm, and over the fist arm you are covering the another hand and placing over the person around the umbilical area or center of the rib cage, and make a quick and hard movement inward and upward. That means towards the top area we need to apply the pressure. So this is called as Hemlich maneuver. And ninth image, what is the name of the instrument in the shown picture? Option A, Alice forceps, artery forceps, episiotomy scissor and surgical scissor. The correct option is episiotomy scissor. So the rationale for that episiotomy scissor, it is used to perform episiotomies during that labor and delivery period. How we can identify this instrument mean? This non-ratches, that mean here there won't be no lock, that is a non-ratches, that is called as non-ratches, and finger ring scissor or angled with smooth, this is the smooth area, and as well small blunted tips you can see. So this is the identification of the instrument for the episiotomy scissor. And this is the way they used to perform the episiotomy. Commonly they used to perform in the mediolateral way. So this is the median line on the given image. On the lateral area they used to cut and make that vaginal pathway bigger one. Easily the child can pass the vaginal opening side. And the 10th image, what type of fetal lie shown in the picture? The options are breech presentation and transverse presentation and vertex presentation and oblique presentation. So the correct option is breech presentation. Here on the image you can see the baby were lying on the pelvis area with the presenting part of the breech. So the correct option is breech presentation is correct one. If you are going with the transverse presentation mean the fetal position will be in this way. The fetus will used to lie in the transverse area, that means the flat surface area. And the vertex presentation mean the head will be present in the pelvis part. And oblique presentation is nothing. The fetus will lie on the pelvis part with a 45-degree angle with a flex position with the head and shoulder. And 11th image, which of the following clinical sign shown in the image? That is Palmer sign, Chadwick sign and Osiander sign and Hegar's sign. So here the correct option is Hegar's sign. On the image, what they are performing mean, that is called as bimanual examination. How we need to perform mean, the 2 fingers in the anterior fornix. So that is 2 fingers will be inserted inside the vagina and 2 fingers below the uterus per abdomen. So this is the uterus area we need to place. So after inserting or placing the hands like this, the abdominal and vaginal fingers seems to oppose below the body of the uterus. So when you are doing this examination, we need to do gently for avoiding the abortion. The demonstrated as softening in the consistence of the uterus, and the uterus and cervix seems to be two separate regions. So this is the thing can be felt during the time of examination, that is called as Hegosian. And 12th image, identify the machine name. Options are ECG machine, portable mechanical ventilator, and USG machine and portable defibrillator. So on the given image is portable mechanical ventilator. So this kind of ventilator will be easy to carry anywhere during that emergency condition. And 13th image, identify name of the procedure in a given image. The options are Gangaru care, phototherapy, radiation therapy, and none of the above. And most of the time they will used to ask, apart from the instrument name, they'll used to ask the name of the procedure or the purpose also. The correct option is phototherapy. The rationale is, so the treatment with the light is known as phototherapy. Mainly when the child having the jaundice, this phototherapy will be preferred. And the distance between the light and baby commonly will be, so the distance between the light source and the neonate is 20 centimeter commonly will be kept. The time duration for keeping the baby on the phototherapy, some baby may need only 24 hours or some baby may need even 5 to 7 days. And 14th one, identify the instrument name in the given picture. That is a Buck's traction, hamlation, Russell traction, balanced skeletal traction, and dynamic traction splint. The correct option is dynamic traction splint. So this instrument also known as dynamic orthosis. So this device commonly used to treat intra-articular fracture of the fingers. So this apparatus consists of 6-inch diameter as a circular splint. This is a completely a circular splint. You can see on the image. This circular splint will give rigid arc with a 3-inch radius equidistance from the involved joints. The wire is placed horizontally through the distal head of the middle phalanx. So here you can see it will be fixed with the wire from the middle of the bone or from the finger. The wire is attached by the rubber band to a movable component attached to the hoop of the splint. 15th image, identify the name of the instrument: surgical scissor, episiotomy scissor, umbilical cord cutting scissor, and bandage scissor. The correct option is umbilical cord cutting scissor. The rationale is, so this instrument completely with the length of 10.5 centimeter. So that is the length of this scissor. The blades are so curved. So this is the blade having curved shape. On the close of the tip, it will use to meet. So this is on the tip, it will use to meet, which prevent the cord slipping during the cutting time. So this umbilical cord cutting scissor, otherwise simply called as umbilical scissor or cord cutting scissor. Similar to this kind of images, you can prepare for the upcoming examination. Thank you for joining with me for the today's discussion. Stay connected. You will get more videos related with the nursing officer exam preparation in future. Thank you.
If the video is informative, subscribe my channel and like and share the video. You can write your comments too.